The Dr. Taz Show, the podcast. Dr. Taz, Superwoman Wellness. Here's Dr. Taz.
Welcome back, everyone. Welcome back to another episode of Superwoman Wellness, where I am determined to bring you back to your superpowered self. Now, every week, if you've been following the show, we have amazing experts on here from around the world talking about all things health, wellness, mind, body, and spirit, all to keep us superpowered. But this time, we are talking with just yours truly. That's right. This is an episode of Dr. Taz Talks, and we're tackling something near and dear to my heart, really what got me into the field of integrative and holistic medicine. I'm talking PCOS, or polycystic ovarian syndrome. And again, it is one of the most gaslit issues that I see in women's health today. And I don't want you to have the same journey I did or thousands of other women continue to have as we speak. So here's the deal. PCOS, polycystic ovarian syndrome, long time ago in ancient history, you can think of people with big beards, old men walking around looking at these things saying, hey, there's this disorder. Women get really fat, they get bald, they have cysts on their ovaries. That's PCOS. They identified it, they understood it, and there was a treatment for it, which was regulating insulin or removing your ovaries, your uterus, all of that other stuff, and taking over hormonal control of your body. But those were the textbook examples. And textbook stuff, I'm going to tell you, because I've taken lots of board exams, is easy. You have those pictures in your head, you can identify it in about 2 seconds. But here's the problem with sticking to the textbook. There are so many people that don't present in a classic fashion. They don't really present with that very, that image of this very large person, really bald and, lots of acne and all that other good stuff. They are actually presenting in little mini ways along a spectrum of symptoms that include metabolic disorders like high insulin, high estrogen, high cholesterol, high triglycerides, along with hormonal disorders like high androgens or high cortisol levels, along with just sort of general inflammation. Now, I'm not the only one to talk about this. Many people have been talking about PCOS, but it's really only within the last few months that I'm noticing a greater awareness around it, to the point that even the Endocrinology Society is saying, hey, wait a second, maybe we got this one wrong. Maybe this is actually not an ovarian disorder, shocker. This is actually a metabolic disorder and needs to be renamed. Imagine that. Well, you guys know my story. If you've been following the show, you know that I was having hair loss and acne and inflammatory symptoms like joint pain and weight gain, put on tons of medication, nothing resolved, and I had a lot of side effects from medication, but ultimately the diagnosis was this. It was PCOS. So it took me years and a career in integrative medicine to figure myself out, and I certainly don't want that journey for you, and it's been so heartwarming and satisfying to be able to impart the same wisdom to my daughter, to have her be able to look at her labs and understand, like, oh my gosh, my androgens are high. This is off, that's off. This is how I need to eat. This is how I need to live my life. So let's break PCOS down just a little bit today and talk about what really you need to be thinking about and where to begin. First of all, let's talk symptoms. So if you are somebody who's had a lot of chronic stress or trauma, if you continue to have hair loss, if you are having a lot of acne, whether it's on your back or your face, if you're having issues with regular cycles, please, please, please get checked for PCOS. Here's what you need to check. Check all your hormones, but check them in a little bit more totality than what's done typically in the exam room. We have to understand where your total testosterone is, where your DHEA levels are, where many of your androgens, including an AMH, which is an anti-Mullerian hormone, and even things like your fasting insulin level, leptin levels are all checked. A comprehensive hormonal evaluation will help lead to the right diagnosis. That paired with a pelvic ultrasound to look at things like your uterine lining and also whether you do or do not have ovarian cysts, help make the diagnosis. So don't be gaslit, get some of these numbers checked, get the ultrasounds done, and have somebody well-versed with PCOS interpret those labs and look for these patterns. Now, here are the patterns I want you to look for, and I want your doctors to look for, or even anybody on my team at Center Spring MD to look for as we're combing through the numbers. Take notes, because I'm going to give you a little cheat sheet. And a lot of this, by the way, is in my hormone guide on my website. So if you go to drtaz.com, you can download my hormone guide, and that in turn will help you maybe with understanding if your hormones are quote unquote normal or out of range for us, or for those of us in kind of the functional and the integrative space. All right, so let's dial it back. What do we need to be thinking about? Number one, so think triangles. I always think triangles with a lot of these chronic conditions. I'll always draw them for patients. So I'll say, okay, here's your, and they love my handwriting, by the way, but they'll say, here's your triangle. There are three corners to a triangle. What do you need to be thinking about? Well, in corner A over here is the gut. What's happening with your gut? What is your gut pattern? Who can think through the two most common patterns I see in PCOS when it comes to this corner of the triangle? The first is gluten intolerance, and the second is candida. So if you are falling in this PCOS spectrum that I'm talking about, check your gut out, understand your gut health. You may have one of those two particular issues, or the third, you may have fat malabsorption where your body is not able to break fats down effectively, and that in turn leads to all the other issues. Okay, so corner of triangle A is the gut. Let's move on to B. It's your hormones. Hormones, again, if they might have shifted for different reasons. There might be a genetic tendency to it. There might be a high stress load that tips you that way. Or you may have a higher environmental toxic load or burden that then in turn is triggering many of these androgenic symptoms. So what do I mean by that? You want to understand where your thyroid, your cortisol, your insulin, your estrogen, your estradiol, your estrone, your testosterone, your DHEA, and even looking at some of the softer ones like AMH, prolactin, 17-hydroxyprogesterone. Where are those guys? And where are they falling in the spectrum of everything? And what does it mean for you? So that's your hormone story. And here's the deal. While PCOS is a common diagnosis, everyone's triangular corners are their own. Somebody could have gluten intolerance and estrogen dominance. Somebody could have candida but have high androgens. Someone could have SIBO or bacterial overgrowth but have a thyroid issue. Or somebody could have fat malabsorption and have an insulin issue. So again, these are personal stories, but you've got to start with the base, and the base is understanding your PCOS triangle. All right, triangles have three corners, right? They don't have two. We talked about one, we talked about two. What's the third? Well, the third is a wild card. I've got to tell you guys, it is a complete wild card, and it's so variable. Here's what I've seen. It's either extreme stress or extreme trauma that has flipped a switch in the body into one that overproduces cortisol and then activates all this other stuff. Or you might have MTHFR. That's the third corner. And that's a gene that very much is linked to chronic inflammation or inflammatory symptoms, and a high need for things like glutathione and methylfolate along with the methyl Bs. Or your corner could be heavy metal toxicity, could be too much organophosphates, or getting too many endocrine disruptors in your environment. So any of these could be pieces of your triangle. It could be a high toxic load from too many medications. I know what my story was. I mean, I can nail it in 5 seconds. It was a lot of stress and a lot of trauma for years, ever since I was a teenager. Trauma, I should say lightly. I wasn't highly traumatized, but there was just a lot of family stress. And that in turn led to my hormone story, which is a very sluggish thyroid and high testosterone, high DHT, and my gut story, which was a need to be gluten-free. And that continues, that story, my PCOS triangle, continues to this day. So that's why it's so important to understand the concept and then to layer on the individual pieces of your puzzle as you're getting things checked and they're being interpreted. But once you solve this triangle, once you can understand where your gut needs to be, what your hormone levels need to be, and also what that tipping point is for you, you have a recipe, a roadmap for success, because you will know how to heal yourself, but then also you'll know when you're getting into trouble again. My first bout with PCOS, or my first awareness, I should say, with PCOS was probably in my mid-20s. And then as I continued through, got better through my own investigative work and trying to put the pieces of my health together, I was better by probably 28, 30, probably by 30, I was truly better. But life progresses, right? I had babies, started to practice, grew the practice, did all this other stuff with my life. And there was a period around, I think it was around like 40 or so, incredible stress. And then again, the same flare, hair loss, acne, it started all over again. I had to double and triple up what I was doing for myself to prevent myself from going into another flare. And I use the word flare on purpose because I want you to think about PCOS as an autoimmune disease. Don't think of it as a hormone disease. Don't even think about it as a metabolic disease. This is an autoimmune disease. And we can flare, and those flares can ebb and flow when our triangle gets out of sorts and starts to look like another shape. So the more you learn about yourself and what those triggers may or may not be, the more you're going to have success for the long road in keeping yourself balanced and healthy and feeling superpowered. I want you to know exactly what your body is doing so that you can be ahead of this, not behind it, and sort of shocked by then who you've become. I was talking to a woman today who was telling me she knows something's wrong. Everything's getting on her nerves. Usually she could handle stress really well. And now the smallest amount of stress sends her over the roof. She doesn't feel good. She's spotting. All this stuff is happening. Well, all of that can change us. It can change who we are, change our mission, change our passion, and change our purpose, and put us on a track that we weren't meant to be on. And we don't want that. We have a God given purpose and a mission, and it's our responsibility to understand the chemistry of our health, put it all together so literally we can move through and move higher where we can accomplish our goals and our mission. I hope that all makes sense, but I literally see it. I see your physical body, I see your emotional body, your mental body. They merge together and they in turn make you who you are. But if you're not going to take the time and energy to understand this particular condition and what you can do to empower yourself, and you stay dependent on the conventional answers of a couple of medications and birth control, then the journey becomes incredibly frustrating with one medication layered on top of another medication, on top of a procedure, on top of maybe IVF, on top of hormone replacement therapy. It's just a dramatic cluster that I keep seeing over and over again. We want to stop it, and we want to stop the gaslighting around this particular diagnosis and condition. And I want you guys to be empowered and understand what to do. All right. So no more lecturing. Go find your PCOS triangle, or if you're suspicious that somebody you love suffers from PCOS, make sure they see this episode and turn around and get the help they need. We're happy to help. Lots of resources on drtaz.com. But until then, again, remember, rate and review this episode of Superwoman Wellness. It's on Spotify and Apple iTunes. And send me other topics that you want me to tackle on Dr. Taz Talks. And I hope you continue to enjoy all the other great episodes we're putting out there with our experts as well. Thanks again for watching. I will see you guys next time.